COVID relief bills with two amazing experts. Diana Protopapa, who you met earlier from Frontline Public Affairs, and we are also joined by Jennifer Pyatt from the Network for Public Health Law. And we will field questions at the end of their presentation, so feel free to use the chat like we did this morning. And I'm hoping that you enjoy this session. I get an opportunity also to tell you a little bit about each person. Jennifer is a researcher, scholar with the Center for Public Law and Policy at the Sandra Day O'Connor College of Law and Arizona State University. She's also a senior attorney with the Network for Public Health Law's Western Regional Office. And before joining ASU and the network, she served as a law clerk to Vice Chief Justice Ann A. Scott Timmer of the Arizona Supreme Court and worked in private practice as a pharmacy regulatory attorney with Quarries and Brady LLP from in Phoenix. And Diana, who you met earlier, is just an amazing person and does our lobbying for Colorado Public Health Association. And she has education as a communications person from Kent State, and then a master's degree in social work from the University of Denver. And as you could tell, she's worked in the legislative and regulatory arena for a long time and has built quite a lot of information, and therefore does amazing work for us as a lobbyist and political strategist. Diana's successes include passing legislation such as increasing access to vaccines and reforms of the mental health system. And prior to joining Frontline Public Affairs, she worked at the Colorado Medical Society for 10 years and served as the Director of Political Affairs and Education there. And as head of the Colorado Medical Political Action Committee, sorry, that was a mouthful for me. She led fundraising and political outreach campaigns. And so with no further ado, I am just thrilled to introduce both Jennifer and Diana to take it home for us on this very important topic about what's going on with COVID legislation, both federally and locally here in Colorado. So where should we start? Ladies, are you ready to go?
I'm ready.
Okay.
Me as well.
All yours. Welcome. Nice to have you with us.
So I know we submitted PowerPoints. Will that be brought up?
Oh, I don't actually have them. Can anybody help me, Chris? Sorry, give us just a couple seconds to get this technical thing.
Yeah, I'll pull up. Let's start with, Dan, is it okay if we start with federal level first?
Sure
Since
thing.
federal's gonna.
Yep, no problem.
Great. Jen, your slides are, Jen, do you want me to advance the slides for you, or do you want to share your screen?
Let me see if I can share my screen. Okay.
That is perfect. We are seeing both you and your slides.
Okay. Okay, perfect. So good morning, or almost good afternoon, everybody. Thank you so much for inviting me to join you and discuss this really important topic of federal COVID-19 relief bills. We've seen a number of bills become law in the previous year, and we expect to see at least one additional bill become law in the very near future. And by very near future, I mean weeks to see the Biden's administration first bill, at least on this issue. So let's go ahead and start at the very beginning. The Coronavirus Preparedness and Response Supplemental Appropriations Act. So this was signed into law on March 6th, 2020, and it provided $8.3 billion in COVID-19 relief. 6.2 billion of that 8.3 was designated as emergency funding for the Department of Health and Human Services response to COVID-19. And some of that funding actually breaks down as follows. $3.4 billion was appropriated for the Public Health and Social Services Emergency Fund to support development of necessary countermeasures, purchase of vaccines, and included $300 million to ensure that all Americans receive a COVID-19 vaccine regardless of ability to pay. An additional $2.2 billion was allocated to CDC, 950 million of that, which is for grant funding or cooperative agreements with states or governments in support of the COVID-19 response. Also, 836 million went to NIH for the National Institute of Allergy and Infectious Diseases to conduct research on therapies, vaccines, diagnostics, and other health technologies, and 61 million to FDA to prevent, prepare for, or respond to COVID domestically or even internationally, including development of necessary countermeasures and vaccines. So that's a lot of money, a lot of different places that it's going. The bill also provided a waiver, removing restrictions on Medicare providers, allowing telehealth services regardless of whether the beneficiary is in a rural community. So actually effective March 6th, 2020, that patient's home could serve as the originating site for the duration of the COVID public health emergency. So this happened on March 6th. Well, the next federal bill to become law followed swiftly after the Supplemental Appropriations Act. And this is the Families First Coronavirus Response Act. Now, this bill was signed into law on March 18th, 2020, and it provided an additional $192 billion in COVID-19 relief. Pertinent provisions of the bill include the following. First, private insurers, including group and individual plans, as well as grandfathered plans, were required to cover COVID-19 testing. So the detection of SARS-CoV-2 or the diagnosis of the virus that causes COVID-19, provided that diagnostic test had received FDA's emergency use authorization designation, and the associated visit in the range of settings without cost sharing, without needing to meet deductible, without prior authorization, or any other utilization management during the emergency period. The law also temporarily increased the federal portion of Medicaid by 6.2 percentage points during the emergency period, so long as states agreed not to restrict eligibility or charge cost sharing for COVID-19 testing services or treatment. The increase did not apply to ACA expansion adults. That's important to know. The law also released millions to domestic nutrition programs, including SNAP and WIC. And with respect to SNAP, work and work training requirements were lifted. So beginning in April 2020, and then for each subsequent month through the end of the month, following the month when the COVID-19 emergency declaration is lifted. So you have it lifted in this month, it continues until the next month. Finally, the law required 14 days of paid sick leave for certain employees, plus an additional 12 weeks, 10 unpaid, of expanded family and medical leave. But that's one of the provisions of the law that expired on December 31st, 2020. So after the Families First Act, or the FFCRA, came the CARES Act. And the CARES Act might be the act that most people are familiar with. This is the Coronavirus Aid, Relief, and Economic Security Act. And the reason that most people are probably very familiar with this one is because it was, at the time, the largest stimulus package in history, a whopping $2.2 trillion in relief funding was signed into law on March 27th, 2020, when the CARES Act passed. And the law amended that FFRCA requirement to require coverage of COVID-19 testing to require coverage even for tests that did not actually yet have an emergency use authorization. So coverage here would need to be provided if the test has an EUA, if the developer had requested or intended to request an EUA, or if certain other requirements, i.e. development with notification to HHS ahead of time, were met. The law also provided for a ready reserve corps to ensure deployable workers were available for public health emergencies, including the COVID-19 response, in addition to national emergencies. The law also contains specific volunteer liability protection for healthcare providers. So it protects healthcare professionals from liability arising under federal or state law for any harm occurring caused by an act or an omission by the healthcare provider with respect to the provision of healthcare services during COVID-19, if those actions are provided within the healthcare worker's scope of practice, and they are provided in a volunteer capacity, which means no compensation or anything in lieu of compensation, and in good faith. Now, this liability protection does not apply to acts or omissions that are willful, to criminal misconduct, to gross negligence, reckless misconduct, etc. But it is a pretty substantial liability protection to keep in mind. And this protection does in fact endure for the length of the COVID-19 public health emergency. Additionally, the CARES Act also incorporated certain HIPAA provisions into existing regulations governing confidentiality related to substance use or disorder treatment records, allowing for patient consent in sharing information that does not require reconsent until the patient actually revokes that initial consent in writing. Furthermore, the CARES Act provided for the Paycheck Protection Program, or the PPP, which is implemented by the Small Business Administration with support from the Department of the Treasury. And this program provides small businesses with funds to pay up to 8 weeks of payroll costs, including benefits. So that's a lot. The CARES Act did a lot more, but those are just some of the highlights. The CARES Act, of course, certainly covered a ton of ground, but another bill providing for additional relief was actually well on its heels. It was signed into law on April 24th, 2020. And this is the Paycheck Protection Program and Healthcare Enhancement Act, providing an additional $484 billion. Breaking that down a bit, the law provided $75 billion for additional funding to reimburse hospitals or other healthcare entities for healthcare related expenses or lost revenues attributable to COVID-19, and $25 billion for necessary expenses related to COVID-19 testing. It also increased that Paycheck Protection Program funding with an additional $60 billion set aside for small, mid-size, and community lenders, including minority lenders. The law also required governors receiving funds to submit a COVID-19 testing plan with goals for 2020. And they had to include the number of tests needed month by month estimates of lab and testing capacity, and a description of how the state was planning to use its resources for testing. Also, the law imposed several different reporting requirements on the Secretary of Health and Human Services. The Secretary, for example, was required every 30 days to provide information as to COVID testing, including identified demographic data, information on the rates of cases, hospitalizations, and deaths. Additional reporting requirements included a report on a COVID-19 strategic plan to be updated every 90 days. So there were some additional relief bills after the April bill that were introduced, but no other really substantial relief bill was passed until December. And in December, we saw passage of the Consolidated Appropriations Act of 2021. And this actually eclipses the CARES Act, providing for $2.3 billion. But the way that that splits out is essentially $900 billion in stimulus relief for COVID-19, and then $1.4 trillion of an omnibus spending bill for 2021's federal fiscal year. And so just to give kind of an outline of what this bill did, first of all, it supplemented the CARES Act Paycheck Protection Program and provided an additional $284.4 billion for PPP loans. The legislation also waived geographic and originating site requirements for mental health services delivered via telehealth, allowing beneficiaries to receive telemental health services in their homes in any area of the country. To take advantage of this flexibility, the beneficiaries did have to receive at least one in-person mental health service during the 6 months prior to the first telehealth service. Furthermore, the legislation provided a 3.75% increase in payments under the physician fee schedule for 2021, and about $3 billion is in increased payments for physician services. The legislation also provided for a new rural emergency hospital Medicare designation under the Medicare program that would allow existing facilities essentially to meet a community's need for emergency and outpatient services without having to provide that inpatient care. And finally, something that we'll talk a little bit more about when I talk about the practical implications of the bills, the law incorporated the No Surprises Act, and this bans balance billing, where out-of-network medical providers bill patients for costs that are not covered by the patient's health insurance. And I'll go into a little bit more detail about that provision in a few minutes. So that is a very diluted, very slimmed down version of all of the relief bills that were passed by the federal government in 2020. But what should we expect in the year to come? The Biden administration has a plan that is currently being discussed, and many pieces of it we may see actually put into action very soon. So let's talk about this plan. The Biden administration's initial relief plan is essentially a $1.9 trillion package. So it is getting close to those 2.2 trillion, 2.3 trillion spending amounts that we saw in 2020. And it would include, initial plans indicated that it would include the following: a $1,400 stimulus check to most adults and children, though there has been some discussion recently about potentially limiting eligible recipients to the funds. $50 billion to expand testing capacity, a $20 billion campaign to speed vaccinations, including starting up community vaccination centers or mobile units, $160 billion to hire 100,000 new public health workers to help with contact tracing and vaccine outreach, and a $350 billion in support for state and local governments. Also, there were some initial miscellaneous provisions to be included in this bill, which included potentially raising the minimum wage, federal minimum wage, to $15 an hour. That may be removed. $4 billion for mental health and substance abuse services, $20 billion for veterans' health and health insurance subsidies, $20 billion for public transit, $20 billion for Native American tribes, $10 billion for cyber defense programs. So the real question is, where do we actually stand on this bill right now? Well, last Friday, February 5th, 2021, both the House and the Senate passed a budget resolution providing for this $1.9 trillion COVID relief bill to essentially pass through both houses via the process of budget reconciliation. And there's a somewhat grainy picture of Vice President Harris on the screen here. She cast actually the tie-breaking vote in the Senate to allow this bill to go through the budget reconciliation process. And essentially what that means is that when the bill has been fully drawn up and is ready to be passed, it will be able to pass through a simple majority in the Senate without having to worry about getting additional votes to prevent filibustering or avoid a filibuster. And House Speaker Nancy Pelosi, as of last Friday, indicated plans to really hit the ground running with this, work to draw up and pass a stimulus plan within 2 weeks. So we really are seeing action take off on this bill right now. Now, we've already actually assessed a lot of the practicalities just by discussing the laws themselves, but I do want to break down some of them just a bit more with a little bit more key attention. So first of all, with respect to coverage of costs for COVID-19 tests. So in addition to this, what providers have to do is publicize prices of the tests. And there are monetary penalties for failing to comply But again, those costs are going to be covered under the CARES Act. Now, additionally, volunteer healthcare workers are granted broad immunity protections from any act or omission arising under federal or state law for any harm arising from actions or healthcare services delivered during the COVID-19 public health emergency. Of course, these services have to be provided in good faith. They have to be provided within the healthcare provider's scope of practice of their applicable license, and they have to, again, be provided on this voluntary basis. But if those requirements are met, this is a very broad-based liability protection. Additionally, there are some liability protections that exist in other places. There are plenty of state-specific liability protections. There are also liability protections outlined in the Secretary of HHS's PrEP Act declarations. And those specific liability provisions have to do with the administering of a covered countermeasure like a COVID-19 vaccine. Those get a bit beyond the scope of what we're talking about today, which is just the legislative actions. But for those of you who are interested, there are many, many different sources of liability protections that are out there for healthcare workers working during the public health emergency. Additionally, we talked about the substance use disorder treatment records. So with respect to those existing regulations, the CARES Act actually includes that provision for patient consent in sharing information, and that reconsent is not required until the initial consent is revoked in writing. Additionally, with respect to Medicare, we talked about a lot of the different waivers that were put into place, but the Consolidated Appropriations Act applied this to mental health services with that caveat that the provider has seen the patient in person within the previous 6 months. So what we've really seen kind of a recurring theme through all of these bills is a lot more acceptance of telehealth provision of services and or need of telehealth provision of services, simply because people would be unsafe potentially going out in droves to see healthcare providers. And it's just safer for people to use telehealth means of communication. And finally, the No Surprises Act, which I promised I would get back to. So this doesn't take effect until 2022. So the practical aspect of this is still a bit far off in terms of when it becomes effective, but it bans that balance billing. So out-of-network providers billing patients for costs not covered by insurance. And it bans balance billing in 3 instances. So the first is when receiving emergency care. Second is when a patient is transported by air ambulance. And third is when a patient is seeking non-emergency services at an in-network hospital from an out-of-network provider. And so basically under this act, patients are only going to be responsible for the same deductibles, co-insurance, and co-payments as they would be with in-network providers. Now, with that said, that was a very brief overview, but I will go ahead and wrap up my portion of the discussion and send it on over to Diana to take us through some of Colorado's state provisions.
Hi, everyone. All right, you should have let me go first because there is no way that I will ever be the wonk that Jennifer is. I'm a lobbyist by trade, not a policy wonk, so bear with me here. We're going to go through what's been happening in the state with regard to COVID-19 executive orders and bills now, legislation now law. I did want to just kind of piggyback off of Jennifer's comment about the balance billing law. Colorado passed this law 3 or 4 years ago, and it pertains to emergent care as well. So no balance billing for emergent care or even planned care when you go to get a procedure done, and then at the last minute they switch out the anesthesiologist and who's out of network, and you're stuck with the bill. The one great thing about the federal law is that it covered air ambulance that had to be a federal fix. We couldn't do that as a state. You might have seen an article highlighted in the Denver Post maybe 5-6 weeks ago about a poor couple whose child had to be airlifted to a facility. I think it was Children's Hospital, and they got stuck with like a $39,000 bill. And we couldn't, our state law couldn't address it because it had to be a federal fix. So that's great to see that happened. All right, we're going to start from the top. You can go to the next slide. I always like, whenever I'm presenting anywhere, is to give you a little bit of the makeup of the Colorado legislature, because that will help you understand things a lot better too. We are a royal blue state. This happened in our 2018 election cycle. We have a Democratic governor, a Democratic secretary of state, a Democratic attorney general, and a Democratic treasurer. The Democrats remain in control of the House by a wide margin, as you'll see. And in the Senate, this should have been updated to show 20 Democrats to 15 Republicans, which just happened in 2020. So as a result, we have been passing progressive measures, and we have been really timely and efficient with the federal stimulus dollars that have funneled down to Colorado. You can go to the next slide. So let's start in the spring of 2020, when we first got the $1.6 billion in federal funds from the CARES Act. So all of the money except for 70 million was dealt with through executive orders. I can send you that list of executive orders. I don't remember all off the top of my head, but a lot of them dealt with telehealth, PPE, and like lifting or suspending exams for new nurses and PAs so that they can get to practice right away and not having to worry about having passed that exam to provide care. Could be a bad thing, but it seems to have worked out well. And also expanding scope of practice for a lot of practitioners too, so they can provide more care where it is needed. But of the 70 million that was appropriated by the legislature, we have a very active governor who is an advocate and likes to get a lot of things done. So that's why he provided so many executive orders with these CARES Act dollars. But of the 70 million remaining, he actually worked with Democrats in both chambers to come up with a slate of bills, a bill package to use those remaining dollars, and they follow here. Ali, can you lift the slide a little so I can see all the bills? If it's not possible, we can share screen too. Okay, you know what? I think it might be better if I share my screen. I'm sorry to interrupt midway. Is that okay, everyone? Okay, perfect. Thank you. Sorry about all that. We'll start with Senate Bill 222. It allocated $20 million to small businesses, including $5 million for tourism business. As you know, tourism is a booming business here in Colorado. I'm just going to go over the brief lines and you can read through the rest, and I'm happy to send this PowerPoint to anybody who would like it. 1410 provides $20 million in direct rental and mortgage assistance to Coloradans, including assistance to landlords and nonprofit lenders. We also contributed about $350,000 for the Eviction Legal Defense Fund that was established in law several years ago, and we continue to add to that fund for folks who need help with their eviction notices. House Bill 1412 allocates $4.8 million to the Energy Outreach Colorado Low Income Energy Assistance Fund. This goes to those renters or folks living in their own homes who are facing their utilities shut off because they can't afford to pay for them. We can go to the next slide. 1422 provided $500,000 for food pantry assistance grants throughout the state. And 1411 dedicated $15.2 million to critical mental health programs and substance use disorder services throughout the state. Senate Bill 212 assures reimbursement for telehealth services. So this was a bill that stemmed from the executive order. So HCPF, Healthcare Policy and Financing, worked with the governor to pass an executive order that would cover telehealth services for those providers currently not covered under telehealth. Keep in mind, telehealth has been in existence for, gosh, 7, 8, 9, 10 years for physicians, physician assistants, nurse practitioners, and the like. But those that were left out, like speech pathologists, occupational therapists, home health care, physical therapy, HCPF and the governor created this executive order to include them in those telehealth services. Senate Bill 212 last summer passed the bill to make those telehealth services for those providers permanent. House Bill 1197 provided $500,000 from the CARES Act for the 211 program that Mile High United Way facilitates. It's a statewide human services referral system for things like job seeking, childcare, food assistance, utility assistant, and the like. Anybody can call 211 and be connected to talk to somebody who provides lots of referrals for you. And then the long bill, which is our budget bill, included $500,000 for domestic violence programs. 1.5 million was for contact tracing for smaller LPA, local public health agencies, and 2 million to increase immunization rates for flu and measles, mumps, and for MMR in children. So in 2020, we had what is called an extraordinary session, or the people in the legislature and lobbyists call special session. It happened in late November, and it's tapped into unspent CARES Act dollars that were left over in unexpected tax revenue. The special session lasted or focused on 7 areas: small business help, child care support, housing and direct rental assistance, broadband access, food insecurity, utility assistance, and public health responses. There were 35 bills and resolutions that were introduced, including 9 bipartisan bills and resolutions. There were 23 Republican-sponsored only bills and resolutions, and 3 democratically controlled only sponsored bills and resolutions. It's important to make note of this because the vast majority of bills that passed were bipartisan, which means they had a Republican and a Democrat co-priming in each chamber. All of the GOP only sponsored bills died, and only one of the Dem only sponsored bills passed, and we'll talk about that in a moment. It's important to note that the special session tends to be very short by nature, and it ran in the minimum amount of time it takes to pass a bill, which is 3 days. You need 3 days for a bill to pass each chamber. And of all those bills that were introduced, only 10 bills passed at the cost of $383.2 million in state COVID relief. let me see here. I think I already talked about that. Perfect. Okay. So of the 7 bills that passed, or 10, I just saw that slide and I'm forgetting. House Bill 1001 provides $20 million to the Department of Education for increasing internet access and aid for remote learning. Right before the commencement of the special session, I think there were 68,000 kids across the state who didn't have access to internet. And I have no idea, I can't even imagine what that was like for those kids and parents who weren't able to learn these past 8-9 months. House Bill 1002 appropriates $45 million to the Department of Human Services for 2 grant programs to increase access to childcare. One of them provided money to sustain childcare centers and expand access and provided money to sustain childcare centers and beef them up, for lack of a better word. The other was to expand access to childcare, especially in those childcare deserts. These were already established, or one was already an established program in CDHS and the other was a new one. House Bill 1003 modified and expands the food assistance grant program that was passed earlier in 2020 by $5 million, allowing for both additional food purchase and increased flexibility for indirect costs. House Bill 1004, targeted for businesses, allows restaurants, bars, and food trucks to keep 2.9% sales tax or up to $2,000 each month that must be repaid after 4 months. The measure reduced the state revenues by $92.1 million over 2 years. 1005 allows local, this was an interesting one. This was run by 2 Democrats. It allows local governments to limit third-party food delivery fees for folks like Uber Eats and DoorDash with certain restrictions. We've been hearing about this building up over the past 2 years of the fees and that the third-party food delivery services place on restaurants, that to the point where some restaurants have stopped using them. And 1006 is a highly technical bill, which I still don't understand. It affects insurance premium, taxes, and credits. Senate Bill 1 provides direct grants and suspension of certain license fees to certain small businesses, especially those affected by health-related capacity limitations like gyms and restaurants, taverns, recreational centers, caterers, and the like. Funds will be provided to local governments that are in compliance with public health orders or in the red or purple levels of COVID restrictions. Remember the dial that the governor created for the state to go by. And it provides direct grants to arts organizations and minority-owned businesses. This costs the state $57.1 million. Senate Bill 02 provides $60 million for supportive housing assistance programs. Grants are provided through the Department of Local Affairs for folks that are experiencing financial need and who are not eligible for all other kinds of assistance. $54 million is designated for the Housing Development Grant Fund, $5 million for the newly created Emergency Direct Assistance Grant Fund, and another $1 million towards the Eviction Legal Defense Fund. So they've been amassing funding, fortunately, from late 2019 to date, so to November. Senate Bill 3 transfers $5 million from the general fund to the Energy Office for the use of the Energy Outreach Colorado, again, to provide assistance for folks who need help with utilities, as we saw passed in the spring. Senate Bill 4 transfers $100 million from the general fund to the Disaster Emergency Fund for public health and emergency response expenses that are associated with the COVID pandemic. As it says here, it's not new funding. So 2021 legislative session. So because of COVID and per the Constitution, the legislature gavelled in for 3 days, starting the second Wednesday in January, which is when they always have to gavel in. But because of COVID, they only met for 3 days, again, the minimum amount of time to pass a bill. And then they recessed, and they are supposed to start up again on Tuesday. And they were hinging that startup date pending COVID rates, but we are starting on Tuesday regardless of COVID rates because we're getting the information now and session starts next Tuesday. They passed the following bills, just a few, largely they were technical. Actually, most of them were technical. One modifies COVID relief 19 programs for small businesses. So remember that small business bill we just talked about? There was language in it that focused on minority-owned businesses. Well, there is a barber in Colorado Springs that is suing the state, saying it's unconstitutional to pick out a segment of businesses to promote. Turns out that he was right, although the lawsuit is not settled, but I think the Attorney General's office scrambled with the bill sponsors to try to fix this law to ward off further suing and maybe even to defeat the current lawsuit, if that's even possible. I'm not a lawyer. Jennifer might be able to answer that far better than me. But basically what it did was it removes the language in certain sections of the statute that highlight minority-owned businesses and calls it disproportionately impacted businesses. And under the definition of disproportionately impacted businesses, they highlight minority-owned businesses. So that was the way of the legislature getting around it to ward off lawsuits. So it's still essentially providing the same relief and help. Another bill that was not technical, although it could be called technical, extended limitations on debt collection actions by extending the timeline in which debtors experiencing COVID emergency may have debt collection suspended to 120 days. Finally, I wanted to alert you all to a website that was founded and created in the very early days of the pandemic, I think March even of 2020. Yeah, it says there since March 2020, where community-based organizations that meet the 3 criteria are eligible to apply: organization type, population served, and alignment with which one of the fund's 3 funding priorities, areas of prevention, impact, and recovery are highlighted. Individuals and organizations can contribute to this. It's not an organization, it's a fund that falls under that Mile High United Way facilitates and is in charge of. So far, they've raised $23.6 million since March 2020. And I just read that the governor has been contributing his paycheck to this fund. And I'm not sure how long, but I think so far he's contributed $70,000 to it. We have a multimillionaire governor, so he's fortunate and has used his good fortune to help others. And I think that's pretty impressive. I think that's the end of my presentation. It was not nearly as smooth as Jennifer's, but I hope you learned something.
Hi, both Jennifer and Diana, thank you so much for your presentation. I've learned a lot. Can you, sorry, one thing is I'd love to invite any questions that you might have using the Q&A function at the bottom of your screen. And we have one question that just came in, pardon me, because I'm going to need to read it. Telehealth during the pandemic has improved access to treating opioid use disorder. HHS has tried to increase access to the medicine Suboxone by removing the X waiver prescribing requirement. Repealing the waiver needs congressional action. Has there been any discussion of adding such a repeal to the current relief bills that you've heard of? So it sounds, you guys can choose who gets to answer that one. It sounds like you need to.
I'll go ahead and jump in initially. I have not. I can't say that I have heard specific news regarding adding any kind of repeal to the current relief bills. So I can't speak on that. I do know that, you know, the House and the Senate are currently in negotiations to kind of decide what actually ends up going into this big bill. And there are updates kind of coming out every single day as to different directions that they might be going in. So that's definitely something to watch for. It's not something that I have personally seen.
Perfect. Thank you for that. And question on just a clarifying question. What was the bill title that expanded internet access? So Diana, I think that was for you.
Yeah, I just responded. I believe you're talking about telehealth, and that was Senate Bill 20-212.
Perfect. So any bills or legislation that may exist or are in the works in regards to frontline healthcare worker protection, resiliency, and preservation due to COVID, especially critical care and emergency care providers?
So I can start, Jennifer, and you can talk at the federal level, but I forgot to mention two things in my presentation. One is that there was a bill that was introduced in I keep saying the summer because the legislature recessed in March and came back on May 26th, and we got to work through till June 15th. They ran a bill that would state that, and there's a technical term that I'm spacing, but it would state that any frontline worker who contracted COVID would be considered presumptive eligibility, I believe, for workers' compensation. So they would automatically be covered by workers' comp if, like, a grocery store worker or a health care provider came down with COVID. That bill was failed. It was killed. That bill will be coming back again. That's the only thing I can think of with regard to legislation around healthcare worker protection and the like.
Diane, I'm not going to say this very well, but there's one I know that CPHA is interested in working on with regard to protecting private information.
Yeah, that's true. Yeah, absolutely. Sorry, I was just thinking the healthcare piece.
Okay.
Actually, the Colorado Association of Local Public Health Agencies is working with actually Yadira Caraveo, who we just heard from earlier this morning, to run a bill that would allow public health workers to keep their logistical information like address, name, phone number off of the internet. There is a current law that provides that privilege to law enforcement and child welfare workers and maybe a few more. We are adding local public health worker, any public health worker, to that list. I know there's something else they're trying to do, which we haven't talked much about, but as you all know, there's been some horrible things occurring for public health workers across the state, across the nation. And what we've heard happening in Colorado, and maybe this is happening elsewhere as well, is that these public health workers who are just doing their job, their homes are starting to be picketed by protesters with signs and slurs and yelling. And so I know there was some talk about trying to amend statute around the ability for law enforcement to step in when that's happening. I don't know if that's going to happen. That might be a separate bill, but we'll keep our eyes out on that one for you as well.
Perfect. Thank you. I don't see any other questions coming in. Any concluding remarks, Jen and Diana, and then we will wrap.
Yeah, sure. I will just, on that last question, for anybody who's interested in the particular federal liability protections that might be available to you, take a look at the CARES Act. Also take a look at the PrEP Act declarations. You can find the PrEP Act declarations on phe.gov. And essentially the Secretary of HHS has outlined very extensively how healthcare workers can receive liability protections for administering COVID countermeasures. And so that includes vaccines, that includes things like the COVID vaccines. So that also is another non-legislative area that you might look to in terms of protecting frontline healthcare workers, those liability protections that exist. In closing, I just want to thank everybody so much. Oh, I see another question potentially.
Yeah, how does the federal level determine percentage or amount of funding that goes to each state?
I'm not certain that I understand what the question is asking, but I will say each state receives a certain federal match for their Medicare state programs. And what the bill that I talked about did is it just went ahead and increased that federal match by 6.2 percentage points. So it allowed the feds to come in and really supplement these state programs by providing more federal money so that the states wouldn't have to shoulder it themselves, just so long as the states kind of followed those requirements.
Perfect. I know you got interrupted in your wrap up. So do you want to try to go again?
Sure. I thank you all so much for having us. This is some really important stuff happening here. And while there, are a lot of provisions that are specifically applicable to COVID-19, we are seeing changes across the field in terms of healthcare changes, in terms of how we're going to see things going forward, in terms of how we're going to see telemedicine reimbursed going forward, the No Surprises Act, banned balanced billing going forward. So keeping in the loop and really paying attention to what is in these acts that kind of extends beyond COVID-19, I think is really important and will fundamentally change the US healthcare system.
Perfect. Diana, any concluding remarks?
Sure. Well, yet another thing I forgot. I just realized, and I meant to piggyback off of Jennifer, but just as the federal government passed a paid sick leave bill, we also did in Colorado that extended 40 hours of paid sick leave to individuals who had COVID or other kinds of illnesses. And then we passed the Family Medical Leave Act through the state ballot last fall. But anyway, I just wanted to let you know that. Thank you all for having me. Just as you all may be intimidated by the state legislature, I am intimidated by the federal legislature. So I learned a lot through Jennifer. I appreciate being here with you all.
Yeah, just echo that, Jen and Diana. Thank you so much for untangling very complex issues for us, and we really appreciate you and all the work that you do. I am gonna move to Allie now, who is gonna provide our concluding remarks, and we just really appreciate it. So in whatever way you can, please thank Diana and Jen for us collectively on the virtual thanking. And Allie, take it away, it's all yours.
I learned a lot. Really value all of the hard work you did to condense the information, because I know there is mountains of work that goes into understanding just one of those bills. So thank you. I want to extend an invitation to everyone who participated today, this event was a byproduct of really passionate Colorado Public Health Association members and the Colorado School of Public Health. We'd love to have more of you join our organization. And if you love this, join the policy committee within the Colorado Public Health Association. I've got a link in the chat that you can go learn a little bit more about how to join. So you can get something like this every month with being part of that group. And finally, we've got an evaluation link that's also going to go into the chat. That's our big ask of you today, is to help us learn if this was a good use of your time this morning, and then other events you'd like to see in the future. So I'm going to make sure that jumps in. And the follow-up from this, we have lots of great slide decks. The slide decks you just saw and the ones from earlier this morning, and then other ways to get involved moving forward. So thanks for attending our very first virtual Colorado Public Health Day at the Capitol. And that feedback is really critical for us to see if virtual events are something you'd like to be part of in the future for that, the annual event that we've been holding. So again, thank you, and make sure you put in the chat any specific things that we haven't mentioned to go out afterwards besides the slide decks. We'll have information from Healthier Colorado for another advocacy training they're doing next week. So yeah, instruct us what you need from this. And we recorded both of the session this morning with the legislator panel and then this session. So you'll be able to review it and share it with all of your friends. So thanks again. And a big thanks to our friends at the Colorado School of Public Health for making sure that we had the right tech to make this day happen. So yeah, can't express enough gratitude for them for making this happen. So thanks again for being here, and please finish that evaluation link for us, and we'll be in touch. But yeah, keep up the amazing work, advocate for public health. Like we learned today, we are part of the boots on the ground, and it's our stories that are going to help make these changes happen. So thanks, and have a great Thursday, and we'll see you around.